Hi, everybody. Thank you all for joining, and I mean that. Thank you for both the panelists and the speakers who have given are attending, and anybody that's attending just to listen in about sort of what we have to bring to you guys. My name is Saira Kalia. I'm an associate professor of psychiatry. I'm the associate training director for the psychiatry residency program here in University of Arizona, Tucson. And I run the perinatal psychiatry track for the psychiatry residents. But most importantly for today, I'm the director for the Arizona Perinatal Psych Access Line, which is why we're hoping that we can tell you a little bit about that. But before we join into that, a few ground rules for today. Anybody that has any questions, please put those in the chat and we'll be trying to get to them as we kind of go along. And if we can't get to them as we're talking, we'll definitely get to them at the end. So please feel free to put questions or clarifications in the chat. We will address them all. The timing might be a little here and there. Part of the reason we're here is to kind of talk a little bit about maternal mental health and hopefully, and the team of amazing people we have in Arizona that care about this and talk about all the other things that they're doing, as well as the launch of the Arizona Perinatal Psychiatry Access Line. And one of the main reasons that we are all so passionate about it is that maternal mental health is still an underserved aspect for the United States. Over the course of a pregnancy, the woman receives medical care in the U.S. and they can expect to be stuck with needles, prodded with ultrasound wands, and have pee in countless cups, and just submit to any testing, measuring, poking that may give us any data on her body or the fetus. But when it comes to mental health, that medical care juggernaut just comes to a screeching halt. And in the US, many expectant mothers can get little more than a checklist of questions about their mood or a cursory discussion with their provider. And the result of that becomes that mental health problems often go unaddressed. Roughly 1 in 5 women in the US ends up developing postpartum depression after delivering a child. And an estimated 25% of those cases tend to emerge within the pregnancy itself. And it's not just in the postpartum area. And the leading cause of pregnancy-related death is mental health conditions. So 23% when you look at CDC data of mental health conditions, and this is leading cause of death. So this is either suicide, overdose, or poisoning-related death. The second leading cause of death, 14%, is excessive bleeding. So by far, when you look at the extent of the problem from a mortality perspective, it is a huge issue, and from a morbidity perspective as well. In Arizona, the problem is also grave. So almost half of all pregnancy-associated deaths in Arizona were related to mental health conditions. And when you look at the Arizona Department of Health Services data, 98% of pregnancy-associated deaths related to mental health conditions or substance use disorders were classified as preventable. I'm going to say that again, just so you guys can understand that gravity of what I just said. 98% of pregnancy-associated deaths related to mental health conditions or substance use disorders in the state of Arizona were classified as preventable. And this is why we're trying to talk more about maternal mental health, and you'll hear from our panel today. The transition to parenthood is a very challenging piece in terms of renegotiating identities and social roles, and a perfect storm for hormonal changes. And infants and mothers have divergent needs. And so in that care, you're more aware of treating not just the woman, but her family. And that's also another reason why we're so focused on maternal mental health, because it's not just focusing on the woman or the mother or the birthing person, it is the focus on the child and the family as well. The World Health Organization describes that postnatal period as the most critical and yet the most neglected phase of life if we're in the lives of mothers and babies. And so that is that, along with the severe morbidity and mortality, is part of why we were passionate about creating the Arizona Perinatal Psychiatry Access Line. And while I've primarily talked about the mental health concerns, I really want to hand it over to my brilliant co-director, Dr. Kathryn Emerick, to tell you a little bit more about the Arizona Perinatal Psychiatry Access Line itself and what it is that we're hoping to accomplish. So I'll turn it over to you, Dr. Emerick. Thank you.
Machines of pregnancy tests.
Great, thank you. Thank you so much, Dr. Kalia, for starting us off. I am Dr. Kathryn Emerick. I am the co-director of APAL, and I'm also a perinatal psychiatrist at Banner and U of A. Dr. Connor, I'm just so thrilled for the launch of APAL, a dream that's been several years in the making for us, and we're so excited to be finally counting down the days to our launch. For people that aren't familiar with APAL, let me share a little bit about us so you have kind of an idea of what we are and what we offer. So APAL is a statewide access line. So essentially what that means is that any provider of any specialty anywhere in Arizona can call our line and be immediately connected with a perinatal psychiatrist, either me or Dr. Kalia. And we can answer questions, we can help them make a plan, we can help them make a plan that's really safe and effective. The service is free and it's supported by Access and University of Arizona. And ultimately it's designed to address both the huge need for maternal mental health care, as Dr. Kalia mentioned, but also to support our colleagues in other specialties who are working really hard and are really struggling to meet this need on their own without the support that they need. The line will be starting on June 1st, so just 1 week from now. And initially will be open Monday through Friday, 12:30 to 4:30, and then moving into the full business hours in the fall. And we talk about APAL a lot as the consultation line, the phone line. But one thing I want to talk about is that we're more than that, and we offer more than that. So other things that we do are we offer trainings to providers, clinics, organizations that are interested in learning more about perinatal psychiatry. And we also have a website that was on the initial slide that was presented. That's apal.arizona.edu. And on this website, we have resources for providers for continuing education. But really importantly, we also have resources for moms and families. So we have national resources like the wonderful ones from PSI, and PSI is on the call this morning. And then we also have local resources. So we have resources divided by county. And those resources include things like support groups, diaper banks, lactation consultants. So a lot of really practical support. So one thing I want to make clear is that the phone line, while that's for providers, anyone in Arizona who's looking for support can go to our website and find the resources and support that they need for themselves or a family member in the perinatal time period. So with that kind of short explanation of the things that we're up to, I'll turn it back over to Dr. Kalia.
Thanks, Dr. Emerick. That's a really great succinct description of what we do. And the training piece has been really valuable to us and important because Arizona is such a big sort of state, and there's so many people across different counties across Arizona. So being able to provide not just frontline consultation, but training, I think will make it easier and overall increase the bench strength in Arizona and sort of continue to solve the problem in itself. And we'll be tracking this data as well, as you'll hear about it. Additionally, as we talk about, as I introduce our speakers, we'll be putting their information in the chat. So if you guys have any further questions, you can reach out to them directly about their specific projects. As you might not know, but everybody on this call knows each other. We've been working in this field. We've been working with each other. So there's a level of camaraderie and appreciation, and we have sort of our own roles that we've assigned to each other. I will not tell you that on a formal press conference, but you might want to ask them later what their assigned roles in our collectives are. And so with that, the APAL line is funded right now through Access. And so I'm going to invite Kathryn, who we call Kate Dobler, to talk a little bit. Kate is the project manager for the state pilot grant program for the treatment of pregnant and postpartum women. Kate, if you could talk a little bit about what it is that you do, maybe not all that you do, but and how you feel like APAL will help in the state.
Absolutely. Thank you for that great introduction, Dr. Kalia. It's really a pleasure to be on this Brady Bunch screen with everybody, and to be able to celebrate this work of APAL. So yes, I am the state project director for this very innovative and creative project funded by SAMHSA, intended to create a hub and spoke model of treatment for women who are pregnant and postpartum and diagnosed with substance use disorder. That really takes the focus of looking at the mom and baby together and supporting that diet to be healthy. Recognizing that we have a system of providers who feel afraid and without the resources and without the knowledge that leads them to feel like they are not equipped to care appropriately to treat patients in this reality, in this complex diagnosis of pregnancy and substance use disorder. At the beginning of this pilot project that I'm the director for, the project manager for, I worked really hard to create connections between folks treating women and creating the relationships and networks that we see evidence today, because I was hearing lots of fear on the part of women, afraid to look for treatment, afraid to engage in substance use disorder treatment, because they were afraid of the outcomes that would happen potentially with them, with their baby, and with other parts of our system. 2 years ago, we had a collection of providers who were nervous and unsure of how to proceed. Now today, we have been able to elevate that need up through various stakeholder groups across the state. We've been able to direct funding to this need, and today we have APAL. And this is an opportunity, as Dr. Kalia just said, for all of those folks who are working frontline with moms with any questions to call, get those resources, another resource to direct parents to, all intended to support moms and babies to be together safely and healthy across the state. So outside of Phoenix, outside of Tucson, yes, most of us live there, but not all moms and not all babies. And this is a statewide opportunity to reach those providers in the communities where they are treating women who need care. So I'm incredibly proud to be part of this group. I cannot wait for June 1st. And thank you so much for giving me the opportunity to be part of this press conference.
Thank you so much. That was such a generous comment. So I appreciate it. And I'm gonna go next to Rachael. Rachael Salley is the Maternal Child Health EPSDT Manager at Access. And I'm gonna ask you to kind of introduce the work that you do, because you've been working in public health for a while. And so the work that you do, and how you feel that APAL will be able to support the maternal mental health in Arizona.
Great, thank you. Do we have my sound okay?
Yes.
We had some issues earlier, so I just wanted to make sure before I started talking. But thank you for that introduction. As Dr. Kalia said, my name is Rachael Salley. I am the Maternal Child Health Manager at Access. So I work alongside Kate, but also in a slightly different capacity, overseeing maternal health care, as well as the EPSDT program, which is known by more people as the Well Child program, so any health care for children under the age of 21. And the Arizona State Medicaid Agency, Access is the largest insurer in Arizona. We cover over 2.4 million individuals and families, including around 1 million children under the age of 21. And because Access covers 51% of all births in the state, we have a majority stake in ensuring that maternal mental health remains a vital area of focus. Supporting maternal mental health also means supporting the health of children, of partners, of families, of communities. And this is why APAL is so important for the Medicaid population in particular. This is also of personal interest to me as a mom who has been asked by a provider whether or not certain medications are safe for me to take during pregnancy, and as someone who struggled with my own mental health during and after pregnancy. And while we know there are a number of potential barriers to accessing mental health treatment for everyone, individuals who are in the perinatal period often face even more obstacles, including a lack of providers who have specialized training in the treatment of perinatal mood, anxiety, and substance use disorders, and which medications are safe for use in people who are pregnant and breastfeeding. Access is honored to partner with the University of Arizona on APAL, as healthcare providers across the state will now have same-day access to psychiatrists who specialize in the treatment of people who are pregnant and postpartum, to answer questions and ensure that their patients are prescribed the safest, most effective medications to treat their conditions. Additionally, the training and educational materials that are provided by APAL will be a valuable resource for the range of providers, from pediatricians to obstetricians and therapists that screen and treat our pregnant and postpartum Access members for depression and other mental health conditions. Without proper treatment, we know that maternal mental health conditions affect not only the sufferer, but her children, her grandchildren, and can cause generational trauma. By investing in maternal mental health treatment, we are impacting population health for generations to come, and APAL will be an integral part of that impact here in Arizona. I'm honored to be here today on behalf of Access and on behalf of myself, and I just want to thank you for attending this morning.
Thank you, Rachael. That was amazing. Thank you for bringing that piece up, because I think we can all say that we have some either personal connection in terms of personal experience or personal connection in terms of a family member, just because of how prevalent the disease is. I'm going to go next to somebody that I consider an inspiration for myself personally, because when I get really tired and like, oh, we're gonna have to find the energy, I think of, well, Michelle's found the energy for years and decades, if not. So she can do it, we can do it, right? And so I'm going to go next to Michelle Lacy, who's the Executive Director for Women's Health Innovations of Arizona.
Thank you for that. Yes, we have the energy, and I can say, having done the work in the state for the last 20 years, just have this team of people here is just the most inspiring part of my job. It's exciting to have this energy. So WHI is a nonprofit and is the largest licensed outpatient treatment center that specializes in perinatal mental health. We believe that all families should have access to specialized care during this most vulnerable time in their lives. Our team of therapists and certified peer support coaches have additional training to provide the best practice treatment to perinatal families. We are the boots on the ground, providing individual, couples, and group counseling across the state to parents and young children during this time. We also bill most insurance, commercial insurance and the Medicaid plans. And we have a philanthropic side of our program to offset costs to those who are uninsured and underinsured. And we do this because we believe that the barriers should be removed for parents to receive the best care. One of our biggest barriers is finding prescribers who specialize in perinatal mental health and take insurance. Unfortunately, due to the lack of providers, long wait times, parents often go undertreated, untreated, or just confused about what to do next. And this is where APAL is going to be so helpful to us. Many of our families will go to their primary care physician or their OB. They feel comfortable with them, and that puts them in a situation where they're not certain. To be able to access reproductive psychiatrists in real time will be a huge benefit to our families to receive the proper care necessary to be well. What we know is perinatal mental health is treatable with proper care. And APAL is going to add that piece that we are missing here in Arizona to ensure that all families have access to proper care. So I am so grateful to you guys for doing this, and your biggest cheerleader at this point. Thank you.
Thank you so much, Michelle. That was quite warm. And I will say that the rooms we're in are very inspiring. And even though the scope of the disease and the burden is so big, it feels like we have partners. And so that makes it so much easier and so much more fun. Speaking of partners, we have a new and an old partner when it comes to the Arizona Department of Health Services. So I'm going to introduce you guys Heidi Christensen, which I hope to have a very long, fruitful partnership with as it goes on. Heidi is the Maternal Health Innovation Program Manager at AZDHS. Heidi, if you could talk a little bit about what is it that you do and our hopes and dreams.
Yes, welcome everybody. And I'm really honored to sit on this panel because truly everyone here is what makes this work happen. My role at the department as the Maternal Health Innovation Program Manager, I work alongside my colleague Lynn Lane, who specializes in our tribal communities. But we are really looking at how to reduce maternal mortality and morbidity. That's our goal, but internally, our ultimate goal and the goal of our task force is optimal health for all birthing individuals in the state. And mental health is a big piece of that. Like has already been said, almost half of pregnancy-associated deaths are related to mental health conditions or substance use disorders. And I know it was mentioned, but 98% were preventable. And when we were looking at that, we didn't have enough focus in the work that we were doing on mental health. And we knew it was really important. So as part of our task force, we have branches into specialties, and we really wanted mental health to be looked at. So many of the members here are part of our maternal mental health task force, and looking at access to care, how it's paid for, how, the availability, awareness just in general for, birthing individuals and their families, as well as providers. And I've learned so much from everybody here. And it just, it feels like in the last year and a half-ish, maybe 2 years, there's just been this really great synergy that's come about with partners from across the state, both at, state agency levels to private providers, even community members, providers. And we, a year and a half ago, we're looking at this kind of a model from Massachusetts and had them come speak to the task force, but we just weren't sure if we had the capacity in the state. But because we've got a really wonderful group of people who know everyone in the state, that's how we got connected with the work that Dr. Kalia and her colleagues are doing. And fortunately, in the matter of a year, things just progressed quickly. And I'm so proud to be part of that process. And, when you look at Arizona having such significant workforce shortages, we have 695 federally designated healthcare professional shortage areas. And to eliminate the psychiatrist shortage, we need 227 more. And that's just in general, that isn't even looking at the specialty of perinatal mental health. And perinatal mental health really is something that we need to see as a specialty, and that is another goal that we're working towards. And APAL is really going to address that, that need for support across the state, because we know no matter how hard we're training individuals across the state, we have needs right now. And this is going to start to bridge that gap, as well as the education piece and resources that APAL will provide. So I'm very excited and can't wait for it to start. Congratulations.
Thank you. I'm also very excited and a little nervous, but good excitement, right? So in terms of other partners, Dr. Alicia Allen is an associate professor with the Department of Family and Community Medicine and University of Arizona. And she is working with the Renew research team, which she'll tell you a little bit more about. The Renew team is to promote recovery through engaging and empowering women. And she is another inspiring person and has a clear, awesome dedication to education as well. So Dr. Allen, if you could kind of talk a little bit about what your team does and how it is that we could kind of collaborate and support each other.
Absolutely. Thank you for that. And I'm very excited to be here and excited for this launch. And actually, before I talk about the Renew team, I'm going to put on a different hat for my PAPN hat. So I want to make sure I put in a plug for PAPN. So PAPN is a Pregnancy, Addiction, and Parenting Newborns Task Force of Southern Arizona. And we work with families who are impacted by substance use disorders while supporting expectant individuals and newborns who are exposed to substances. So PAPN was originally created in 2018 by a couple of healthcare providers at Tucson Medical Center, TMC, when they observed how disjointed programs and services for this community was. So the goal has been to build connections and build the network so we all get to know each other and the resources that are available here in Southern Arizona. So now we have about 250 members who include parents, families, healthcare providers, people from the community services, Department of Child Safety, newborn home visiting programs, personnel from the justice system, and more. So again, our goal is to collaborate through education and networking, and we do this currently by holding monthly webinars, which are on the third Tuesday of the month. Let me know if you want to join any of those, and also participating in any regional conferences as we can. So we are super excited for APAL's launch, because one of the major gaps we've come across and kind of some disconnections we've noticed is in the realm of mental health services. So our members are often looking for services and resources. So I look forward to connecting with APAL when those questions come up so we can know how to guide families and other PAPN members. The other thing I'm really looking forward to is hosting APAL at one of our future PAPN events, so our community can gain some more critical knowledge here. So now I'll turn to Renew, and I'm super personally excited to share this and looking forward to how we can connect with APAL. So I'm the founder and the director of this federally funded research program. And like Dr. Kalia says, Renew stands for Recovery Through Engaging, Empowering Women. And we basically seek to identify female-specific factors such as the perinatal period and how those factors contribute to addiction and how we can ultimately use them to empower women to overcome addiction. So we currently have 3 studies who are enrolling women during the perinatal period to explore how postpartum hormones influence addiction in the postpartum. And we are not equipped to help people in these studies with their mental health needs. So having APAL as a resource that we can call to connect our participants with the resources that are available is going to be extremely helpful. And then the very last thing I'll mention is that as an epidemiologist, I love data. So I'm like very, very excited to work with Dr. Kalia and Dr. Emerick in the future to explore the data they've gathered and look at how this great resource has helped address this community need. So overall, I'm just very excited to partner with APAL and ultimately help the women in Arizona address their mental health needs during this critical time in their lives and baby's life.
Thank you, Dr. Allen. We are very excited to partner as well. And you call us, we'll be there in terms of anything you need for education. I'm going to invite Dr. Andrew Rubenstein next. Dr. Rubenstein is the academic chairman at the Department of Women's Health, OBGYN at Dignity Mental Health Medical Group. And also he is the co-chair of the Arizona Department of Health Services Maternal Mortality Review Committee. And I think and from both perspectives of being an OBGYN, chair of the department, and the MMRC for Arizona, I can speak a bit to how that the sort of the impact of disease and being a frontline provider themselves. So Dr. Rubenstein, I think you're there. I'm gonna give him a second. He said he had many patients this morning, so he'll jump back in. If Dr. Rubenstein's not there, then I will go to PSI. PSI has been one of our strongest collaborators and champions in the last few years. And it has been honestly such a comfort to know that I can call and text and harass, though have not done that too much, hopefully. And so I'm going to invite Dr. Leigh Lewis and Elizabeth Wood. So Dr. Lewis, if you could kind of talk about your work as our co-chair with PSI and what you're finding in the state of Arizona, because you're specifically PSI Arizona. And then we'll go to Elizabeth.
Okay, thank you very much. My name is Dr. Leigh Lewis, and I am Vice Chair of Postpartum Support International, the Arizona chapter, and also provide direct perinatal mental health care for patients. As we wrap up Maternal Mental Health Month in May this year, we at Postpartum Support International thank Doctors Kalia and Emerick and welcome the APAL line to the community of perinatal care providers. As Arizona is literally a desert in terms of trained perinatal mental health providers, especially prescribers, this line will provide a much needed resource for those of us prescribers working with perinatal families to increase access to care and decrease stigma for our patients. Currently, 50% of those suffering with perinatal mood and anxiety disorders do not get the care they need. And unfortunately, many providers of all stripes don't know that many psychiatric medications are safer for mother and baby than untreated perinatal mental health disorders. The ramifications of untreated disorder can have generalized consequences and impact the family for generations. Providing this care, just like raising a healthy family, takes a village, and we at PSI Arizona welcome the APAL program with open arms and look forward to working together with mental health providers in Arizona. Thank you all very much.
Thank you, Dr. Lewis. And I'm going to have Elizabeth Wood kind of talk about PSI Arizona. Elizabeth has been just such a wonderful collaborator and like by far some of the fastest responses on any question that I have. It's kind of impressive. So if you have any tips on that, I will take them.
I don't know. It's one of those, you just get it done, right? I appreciate that. Thank you so much. Elizabeth Wood, I am the co-chair of PSI Arizona alongside Dr. Leigh Lewis. And my mission here is not just to be able to provide the free resources to help seekers that are suffering with perinatal mood disorders. And, PSI, we also do the training for providers, frontline providers, free training, or people want to get fully certified, as Dr. Leigh Lewis was talking about. We do the whole gambit. And you know what? Every single time when I talk to people about Postpartum Support International, the response goes something like, oh my gosh, PSI has so many amazing free resources. I wish I would have known about that when I was going through my thing. And so that is our mission. We have so many amazing resources. We need to get the word out there. And this group of collaborators here today just goes to show what is possible. So in Arizona, we are definitely leading the way in a lot of ways, where while Dr. Leigh Lewis says it is sad that we are in a perinatal mental health desert currently, but that is changing. So while we do have 50% of our counties today that do not have any certified perinatal mental health providers, where we are headed is a very different direction. We just completed the first ever nationally, never been done, all person of color perinatal mental health certification training. That was a huge thank you to Dr. Kalia. She was one of our presenters in that training. And then also to the Department of Health, because we were able to award a number of scholarships to the 100 or so participants that were able to come to that training. And that all BIPOC training is so important because over 55% of our birthing individuals identify as people of color, yet fewer than 20% of our certified perinatal mental health providers also identify as a person of color. And we know that the rate of, or the outcomes go up by almost 50% is what's been told when we can get that cultural congruency between the provider and the person who is struggling with perinatal mood disorders. So we want to say thank you to this entire amazing group of collaborators. We are all here together. We can't do it alone. Just like Dr. Leigh Lewis said, it takes a village to make this happen. And we are just so grateful that APAL will be able to help close even more of the gaps that we recognized and that we are closing and making a huge difference. Thank you.
Thank you so much. Yeah, and again, I'm so grateful for all of you for taking the time today. I'm going to see if there's any questions, and I know that the recording is going out somewhere, so we'll figure that out. So will this access line be available in different languages for the providers, and will it ever be open to the general public? No, for the second part of the question, the access line will not be open to the general public. This is the 20th access line of its kind. So we're the 20th state in the country to come up with it. And the design of the access line is to be targeted towards prescribers and frontline providers. We will, of course, if patients call and if there's any resource questions, we'll try to address it, but it's not targeted towards the general public, if you will. There is a PSI helplines that are targeted towards the general public, and those are national options. So that is something that we have already put on our website in terms of if people are coming looking for that information. So that does exist. In terms of access line being available in different languages, we have resources on our website in terms of different languages, but I don't know that we will be able to provide it for different languages for the providers. Dr. Emerick and I are bilingual well, I don't speak Spanish, I speak Urdu, so I can help out providers there if that's needed. Dr. Emerick, is there anything else you would add to that answer?
I don't think so, outside of, ultimately the dream also is to be able to provide direct consultation. So not that
Thank you.
Not that the line would be open to the general public, but ultimately long term what we're hoping to do is to be able to provide consultations and do intakes directly with a patient over tele. So not that they would have complete access to it, but that we would have direct patient contact.
Yeah, and that's kind of phase 2. That's the dream, is to be able to offer that, because I also think that a lot of the times providers are like, can you just see them one time and make sure and tell me what to do? And I think it'll just help build provider confidence and being able to kind of be able to see patients ourselves, because that's honestly what I was trained to do. becoming a doctor. That was kind of the job. And so I'd want to make sure that we get that piece done too. And that's hopefully the next space. Dr. Rubenstein has joined us. So I'm going to give him a moment, guys, as a reminder. I know that I introduced him already, but he is the academic chairman at Dignity Health for OBGYN, and he's the co-chair for MMRC in Arizona. Rubenstein, I did a longer job, but I know that you have patients this morning. So if you could kind of talk about your experience, both in terms of being an OBGYN, and also being the co-chair for MMRC, and what you've witnessed for maternal mental health in your career.
No, thank you. Thank you all for the wonderful introduction. And it's very humbling to work with, and I'm very honored to work with the team today, and really the statewide collaboratives that we're working on. I'm a general OBGYN. I've been doing this for 32 years and really have seen the clinical disconnect in maternal mental health, and the clinical care needs that are so essential. And the role here in Arizona, previously I was in New Jersey, running the New Jersey Perinatal Quality Collaborative. And this is a tremendous step in opportunity that I've seen that we're able to initiate for our citizens of the great state of Arizona and their families. It's the dyads, it's the triads, it's the preventable morbidities and mortalities that we talked about, but also the preventable near misses, the disconnects that occur from our families, and how that affects both personal lives and the ACEs that we often talk about as we move forward. And this is an important practical solution for our providers, who I think are desperate to make that connect and are struggling to make that connect for what to do for their patients and their families moving forward. ACOG literally just came out with their clinical practice guideline for the treatment and management of mental health conditions in pregnancy and postpartum, which I think again will lay that groundwork and provide the much needed support that we're providing in the maternal health crisis that we see. And the maternal health crisis also, I would say, was maternal mental health crisis, as we really looked at the MMRC here in Arizona, as I co-chair that. As we've talked about, these are preventable diseases, if provided that they have access and care, which our great team is really providing across the state. And we do realize, as Kate talked about before, not everyone lives in Tucson and in Phoenix. And how do we address this in that rural components and have access for our providers who are on the front line? So this is really an amazing opportunity to impact the families that we care for on a day-to-day basis. So thank you.
Thank you, Dr. Rubenstein. And I think another thing that I'm realizing is that I want to make sure that we are highlighting that we will be working with substance use disorders as well, because it is a big factor when it comes to our state, and the data on it is sobering for us. And so that'll also be part of the trainings that we'll be providing and consultation that we'll be providing. Are there any other questions or any other comments that any of the panelists want to make? Because I put you on very tight timelines and you're like, oh, I wish I had a minute to say that. If that have come up, please feel free to unmute and bring that up. Otherwise, I'll give us another few minutes here and then set you all free. Kate, I see you unmuting.
I did. I just want to circle back into the substance use disorder treatment capacity that will be added to the system through APAL. In particular, providers who are trying to be supportive of pregnant and postpartum people who are also struggling with substance use disorders. This meets a significant need. And ideally, we can create greater capacity for people who are pregnant to be able to see a single provider who can then connect them with the resources and treatment that they need and feel competent doing that. And I think that as a state, as Dr. Rubenstein just said, we will see better outcomes. We will see fewer near misses. And ideally, in the work that I do, that Rachel does, that Dr. Rubenstein does, that Elizabeth Wood does on MMRC, and reviewing those cases, that we will see fewer women who do not live past 1 year of the end of their pregnancy. We need to see moms and babies live. and not just live, but thrive. And mental health and perinatal mood and anxiety disorders are real and deserve to be seen and heard and treated. And I think that this is a significant resource for the state of Arizona and to move our system forward to support all of our moms and all of our babies.
Yeah. Thank you for that. I think that was a very good reminder. Additionally, if people call us and they're like, what do I do with perimenopausal depression? Of course, we can guide you around that too. So our expertise is across the reproductive lifespan. It's called Perinatal Psychiatry Line, just because I think it kind of drives home that particular phase of life and that transition of life that happens. So we will be able to provide support across the reproductive lifespan. Perinatal APAL just sounded fun too. Like, I want you to call a pal.